Okay. Okay. First, I will start with what we have done this morning. Uh, uh, Basically, a procedure towards what they call examination of the musculoskeletal system. Okay. Now, briefly, let's imagine that a case is presented to you. Okay. See? Okay, good. Now, we are going to follow the procedure. Basically, a good standard procedure that I'm going to present. Basically, it's just a procedure of clinical examination. Standard for all examination is a physical examination towards trying to find out the cause of the problem or disease, right? Now, same like other species or any other system, there is no difference between the examination of musculoskeletal system to any other system. But what is important is towards the examination, the emphasis is made on the area of the musculoskeletal system, which might be slightly different from examination or clinical examination of other system. Now, first, just like any other disease, a horse is presented either to you or through a call, a complaint of musculoskeletal system. As I mentioned, one of the most common complaint will be lameness. So during the communication, either before the horse is presented to you or at presentation, try to get as much relevant history as possible. Of course, standard history like age, sex of the horse, or whatnot might not be that relevant until unless it try to point toward the condition you are looking at. But more important, what they call question that to be done is, for example, in musculoskeletal, uh, uh, what sign does the owner observe? Is it lameness? Is it stiffness? Is the horse lying down and whatnot? So try to get as one, but usually that will come as a complaint. Now, there is possibility, as I mentioned this morning, that the actual etiology or the possible cause of the factor is known, right? Like a horse might have a fall, uh, uh, being hit by another horse, kicked by another horse in the paddock and whatnot. So things such as that you should ask. So it is how it happened, when it happened. Uh, when mean we want to know how acute the condition is, or is it a chronic condition, whether there is any recurrence or whatnot. So how, when, and other related what they call question like whether it has been treated before, does it respond, recurrence, type of work that the horse is doing. So as much as possible. Now, once you get the history, you might be visiting to see the case, or you are there, the horse is presented to you with the complaint and you ask for the history. When the horse is presented to you, whether it is walk to you or in front of you, try to look at some possible sign, visual examination. If the horse is walk to see you at the stable, you might be able to see whether the horse is lame or not walking. So two possibilities, they might walk normal. Most of the time they walk normal. Small percentage severe lameness, they might be lame at walk. So when they walk to you with lameness, you can see that. And that's basically what we discussed in the morning, grade 4, right? Grade 4, which means the horse is still bearing weight, but obvious at walk. Now, so when the horse is in front of you, complete your visual examination. Just take a look around, left, right, anterior, posterior, sometimes trying to have some sort of area view by looking at the back or the horse and whatnot. So check that visual examination will also show some possible sign like uh, the way the horse is standing, Of course, if it is non-weight bearing lameness, grade 5, the horse will be walking without bearing weight at all. So that you probably know. But maybe you have come, the horse is standing in front of you, the horse is still stationary, observe the characteristic of what they call standing. Then look for any obvious sign of swelling. But of course, the history might help you to pay more attention on which leg. The owner will say that the horse was found to be lame on the left leg, left foreleg. So when you do your visual examination all over the body, don't skip just a quick visual examination round, and maybe you want to focus on the left leg. You might see swelling, you might see what they call, you might see there's some disturbance there. You might see swelling, you might see wounds, you might see many things, right? So visual. At the same time, remember, visual examination is done together with confirmation. Confirmation is important. We'll discuss about confirmation in the equine medicine lecture because confirmation might contribute to lameness. So this is done together with visual examination for sign and confirmation. So basically, it is a quick observation that will probably take you 1 or 2 minutes only. Left side, anterior, posterior. But for confirmation, you need the horse to be standing square. Okay. Now, after you have done that, if lesions are obvious, signs are obvious, you might want to uh, quickly examine in detail. But usually, you might see only swelling, which doesn't indicate whether the horse is lame on that particular leg. And sometimes the owner probably might not be able to identify lameness well. So do not, you listen to the owner, but do not give full trust, because what you are going to do next is to ensure that you have to confirm which leg the horse is lame. And when you confirm the leg, the which horse is lame, that will guide for you to do a detailed examination. So I would recommend after presentation, look at the horse. You don't find anything obvious, you have to confirm which leg that the horse is lame. That is the common complaint, common sign of musculoskeletal system. And lameness in horses is best examined at the trot, which means you need to trot the horse. You know what trotting is? There's so many movement of horses. You have trot, you have walk, you have trot, you have pace, you have canter, you have gallop. Okay, you know what trot is? You don't know. Basically, it is uh, two sequence movement with the what they call collateral leg, which means left fore and right hind, right fore, left hind, moving at the same time or striking the ground at the same time. You want detailed definition, and all other type of movement or gait, we call it gait in horses, go back and refer. So trot, but seldom we walk. Why? As I mentioned this morning, seldom a horse is a horse shows sign of lameness at walk until unless the condition is so severe. Maybe 2 or 3% of the condition you see they be lame at work. So a walk, those are severe. Only trot. So get the owner to trot the horse in a straight line. So after you have visual examination completed that, trot the horse. The owner, the groom, or the rider, whichever, will trot the horse away from you. When it's trotted away from you, observe the hind quarter. There should be a symmetrical movement of the hind quarter. I will show you in the slide, in the visual, what they call in the video in a minute. Because when the horse is trotted away, uh, the movement of the hind quarter, or I call it the movement of the buttock or the horse, should be symmetrical. Because when the horse trot, they be just like us walking, right? When the horse trot, you are looking from behind, you are looking at the back or the buttock or the horse, concentrate on that. One will go up, one will go down, right? So it is movement up and down. They should be up and down symmetrical on the same line. That's normal. If it is not symmetrical movement, like a hip hop, you have what they call pain on one leg, you tend to hip hop on one side, right? So the movement is not symmetrical. I will show you in a slide with in the video, which is better to understand. So horse is trotted away from you. Observe the movement of the hind quarter. If they are movement in symmetrical form, those hind quarter is normal. Okay. If you have a hip hop or uneven movement on the hind quarter, that is abnormal, indicating lameness on the hind leg. Okay. Then the horse will be trotted towards you. When the horse is trotted towards you, observe for the head nod. Head nodding in horses, that means the head goes down and up, right? Normal trot, there's no head nodding. The horse might be just looking left, right, but the head is straight, no movement, no nodding actually. So that's normal. So if there is a head nodding, it indicates lameness. So you have got to be good at looking at the head nod, because that is a good indication of lameness for the front leg especially. So you have got to see the trot. The principle or the theory of head nodding is this. Gait, trotting gait. Trotting is like marching, you know, when you march, your left leg or the horse left leg strike the ground, the right hind at the same strike the ground. The right fore and the left fore is up in the air. As it moves forward, the right fore strike the ground, the left hind strike the ground at the same time, the other two leg is up in the air. So that's what a trot is. How do you get head nodding? It's like us, when you have pain on the left leg, for example, you have your limb on the left leg, when you walk, when the left leg, the painful leg touching the ground, you don't want to put full weight on the left leg, correct or not? You are trying to shift the weight to the right by shifting the center of gravity. How you shift the center of gravity, you are upright, is by tilting towards the right. How you tilt? Sometimes you tilt your head, you put your head to the right, so center of gravity move to the right, so your weight will be borne more on the right than the left. That will reduce the pain. So the same with the horse. When the horse when the left foreleg strike the ground, the movement, the center of gravity will be moved forward, then there is pain, right? To ensure there is less pain, the horse will try to ensure that the center of gravity is tilted behind. Horses don't tilt sideways like human, they tilt behind. So what they do is, the moment the left, let's say the problem leg is on the left side, left foreleg. The moment the left foreleg strike the ground, it's painful, correct or not? So to reduce the pain when it strike the ground, the horse will lift its head up. So when it lifts its head higher, center of gravity, weight will be more borne by the hind leg towards the back. You want to try, you lie flat on your stomach and raise your head. When you raise your head, you feel as if something moving towards the back, right? That is the shifting of the center of gravity. So the pain will be reduced. So, but trot is a continuous process. So when the right foreleg, which is the normal leg, strike the ground, the painful leg is up in the air together with the right hind, the center of gravity will shift back forward by nodding its head. So the horse will nod its head to push center of gravity forward, raise its head to push the center of gravity backward. So that is what we call head nod. So as the horse is led, the head will bounce up and down, up and down, up and down. So you see the bouncing or the nodding of the head to indicate lameness. So the first thing you need to do, wash the head. If the horse is nodding, that is confirmed lame, because no horse will nod if it is not lame. So the moment you see the head knot, number one, you have come up to what they call, you have come up to your what they call finding that the horse is lame. Next, to determine which leg is lame. During the process head nodding, see where when the horse the head goes down, which leg strike the ground. It's easier to see the horse nodding down. Nodding is down, right? The horse nod when the leg strike, right? It's very more difficult to see the horse go up. So the head goes up. So you have got to see both. Which leg strike the ground, uh, which leg not, which head not. So when the horse, let's say the horse nods its head when the right leg strike the ground, it indicate that the lameness is on the left. Why? Because when the left strike the ground, the head goes up. Yeah. But now you are trying to judge when the head goes down. So down, down, down. So if a lame horse is lame when it's trotting, let's say it's lame on the left. Left strike the ground, the head goes up. Right strike the ground, the head goes down. Left strike the ground again, the head goes up. Right strike the ground, the head goes down. That's nodding, yeah? Continuous nodding. Observe for that. Look which leg. Then you make the diagnosis. Head nodding, uh, either left or right, indicating lameness. Okay. So once you have confirmed which leg that the horse is lame, then when the horse is back, so probably you want to trot once or twice. So you have got to be good at observing lameness. Don't try to do many times because you are not sure. If you do 3, 4, 5, 10 times, you are not able to detect which leg the horse is lame, then the owner will get fed up of you and probably don't have trust. One trot is good enough. Second trot is not too bad. Right? So once the horse is trotted back towards you and stop, you already know whether it's lame on the left paw, whether it's lame on the right paw, whether it's lame on the left hind, whether it's lame on the right hind. This is where you need to do a detailed examination. Detailed examination, you have got to uh, palpate, feel for heat, pain, swelling. Now, so to proceed with the detailed examination, what they call, when the horse is in front of you, the first detailed examination for palpation is best done on the area of the hoof and the sole. Why? Because 70% of lameness is in the sole. So it's better to check there first because chances you will find the problem there. Okay, so pick up the leg, uh, and what they call, use a hoof tester and palpate. Because the sole is hard, the hoof is hard, you can't palpate, you see your finger not strong enough. So you get the help of a hoof tester, put the hoof tester on the area also and press it hard, pinch it hard. So if you land on where the problem is, the horse will react by pulling its leg to show that it's painful. So keep testing on all the surface of the sole because the point or the pain are usually on one or two area only. Example, if there is a stone bruise, you have not done stone bruise yet, we'll be in equine lecture. Stone bruise, bruising of the area of the sole on one spot. Only when the hoof tester is there, then it will react painful. Otherwise, it'll just stay quiet as if nothing happened. So you are trying to locate where the point or the pain in the sole is. Sometimes it's painful all over the sole. For example, in the area where in condition of soft sole and thrush in horses. So it's sensitive all over. In cases of laminitis, it is sensitive at the what they call white line. Puncture sole, you may even see sign of area that's punctured and bleeding there. So you do your detailed examination of the hoof and the sole. You might not find anything there, then you work your way up to see where the problem is. If there is swelling of the area of fetlock, pastern, feel for the swelling, whether it is soft, edematous, whether it's hard swelling. You see swelling of the tendon, feel for the swelling. You feel for pain. How to feel for pain? When you press your finger on the problem area, it's painful. The horse will jerk its leg or react to it. So that's why we call it palpation for heat, because you can feel for the heat, that's inflammation. Palpation for pain, you press, the horse react. So palpation for pain, swelling and heat. So swelling you can feel, right? So that's what detailed examination is. And feel the whole area. Feel the cannon bone, ligament, joints, tendons, muscle, all over. Okay, try to. So after you have done all that, high possibility you know which leg is lame for sure. You already knew which particular leg is lame. Then through your detailed examination, you might come up with a final diagnosis. It could be a stone bruise, it could be a sole abscess, it could be a fracture or P3, it could be laminitis, it could be thrush, and further on the legs, not the sole, you might find there is tendinitis, there could be desmitis, the swelling of the joint indicating arthritis, possibly ring bone we have discussed this morning. There are other osteoarthritis like what they call, first you have ring bone, you have ocellates, you have bone spavin, yeah, you have if it is tendon desmitis, ligament desmitis, tendinitis, in the couple joint capitis. So there are many, whole series. So while you do your detailed examination, you will probably come up with a final diagnosis. If there is no final diagnosis, you have some differential, you have got to use some aids of examination or aids of diagnosis, right? What they call things like I've listed just now this morning, right? Right from flexion test. Flexion test is diagnostic aids. Why? If you suspect there is some pain in the joint, the horse is throttled, lame, for example, grade 2, inconsistent, right? You want to check whether, because when it is inconsistent, you are not sure whether it's right or not. You want to determine whether that particular joint is lame or not, or painful or not. You flex for 1 minute. After flexing for 1 minute, you trot the horse. If the problem is there, it is indicated by worsening or exaggeration of the lameness. If grade 2, after flexion, it become grade 3 or grade 4 even. Lameness, that shows that the problem is in that joint. That's what we call positive flexion test. If negative, it's not related to the pain there. You flex, you trot the horse won't feel a thing. It's the same. The degree of lameness will not be worse, will be the same as before the flexion. Or if the horse is sound before flexion, it still be sound after flexion. So other than flexion, so a lot of cases of arthritis can be tested through flexion test, flexion of the joint. Now, other than flexion test, you can also use nerve block. A nerve block basically, if there is pain on certain area of the leg, for example, in the area of the sole, horse is throttled, you test, you feel that there could be a bruise, but you are not sure, or there could be a laminitis, you are not sure. How to confirm? You do a nerve block. Depending on where the problem is, it can be posterior digital nerve block or volar or digital nerve block. The moment you do a nerve block or local, by putting local anesthesia on the nerve there, infiltration, right? The moment you have done that, the anesthesia will desensitize the nerve. If you are on the nerve that supply the painful area, when it is desensitized, there's no pain on that area, the horse doesn't feel a thing. Trot the horse after nerve block. If the horse is trotted sound, that will prove your suspicion that the problem is there. But if the horse is trotted lame, two possibility. One, the problem or the pain doesn't come from the area that you suspect. Or of course, the other thing is that your nerve block doesn't work. You didn't do it well. It doesn't desensitize the nerve. So you have nerve block. Nerve block can be done to, for example, in case of laminitis, stone bruise, fracture, anything that causes pain on the area where you can nerve block. Okay. Other thing, you suspect fracture or you want to see how the severity of new bone formation in the joint and whatnot. For the bone, X-ray is the best. X-ray can be used to diagnose what they call that we do this morning, ring bones, ocelot, fracture, all kinds of fracture in the joints, in the bones, in wherever. So what they call, and look for the changes. Okay. So on top of that, what are other example of condition and aids of diagnosis? You can do what they call test the enzyme, blood test, right? If there is damage to the muscle enzyme will be released in circulation. If you do an enzyme test, take a blood test for AST and CK, they will be elevated, confirming that there is muscle damage, like in cases of exertional myopathy, right? If the horse has been recumbent for long, the muscle enzyme will also be elevated because of the damage or of pressure necrosis damage to the muscle, right? What else you can do? You can do aspiration of the joint. You aspirate joint fluid. You aspirate joint fluid, you can look at the nature of the joint fluid, whether it's viscous, whether it is less viscous, like in cases of traumatic arthritis. You can also culture if you suspect there is suppurative arthritis. You see that the joint fluid is already cloudy, what they call yellowish, could be pus in there in cases of suppurative arthritis. But if you have traumatic arthritis that will have injured the bone or blood vessel in the joint, the joint fluid will be blood tinged, right? So you can culture, you can observe, or if there is infection, even without the pus, you might see a lot of neutrophils and whatnot indicating possible infection. So joint aspiration, you can even do arthroscopy. Okay, put in arthroscope and see whether there is such thing as what they call chip fracture, slack fracture of the joint, especially the slightly bigger joint. We can use arthroscopy, like knee joint, hock joint, above what they call hock joints, stifle joints, and whatnot. Okay, those will fit the what they call arthroscope. Okay, so these are some of the example of certain aids in examination that you can use. Okay, now, so with all those, so many differential, you come up with aids or diagnosis, you might be able to come up with the final diagnosis. At times, you do history, visual, you try to confirm the lameness, the horse doesn't seem to be lame, then listen to the owner. Like for example, he complained that the lameness is on the left. Try to do a detailed examination and you can't find anything. So you do not have a differential. But remember, the complaint is the horse. So you must get the right history. When is the lameness? Immediately during work, for example. But the horse is no longer lame. So it's either when you examine, it's either you will have recovered in cases of traumatic injury, or you need to get more detailed history. Like the owner might say the horse is lame only when it is ridden. The horse is lame when it's turning in circle. That also is lame when it is turning anti-clockwise. When it turns clockwise, it's not lame. The horse is lame after work. The horse is stiff a day after work. So when you get all those type of history, it's not wrong for you to examine. When you come to the stable, you probably examine based on the history. You might if you come up with some finding, that's good. If you cannot get any finding, maybe because you need to confirm with the nature of lameness. Lameness one day after work, or stiffness one day after work. Lameness when it is ridden, turning clockwise only. Okay, things like that. So during the course of examination, you cannot find anything. So you have got to confirm and to see what it is. Is it really that the horse is lame at work? So put the horse to work if it is needed. If it is ridden, ask the owner to ride. Okay? If stiffness, it happened 6 hours after work or 12 hours after work or the following day, you do that. Come the following day and see whether the horse is stiff or not. Then complete your examination. So for example, the horse is really stiff one day after work when you come. You come during the day before work, nothing. You come one day after work, the horse is stiff. So it could be exertional myopathy, right? Then you put in your aids of diagnosis again. So examination of work might be required at times, okay, and implement it. After you've done everything, you might come up with a final diagnosis. While you come up with final diagnosis, you do the treatment and control accordingly, okay? Now, these are the details, right? So these are the details of the what they call examination that I have been discussing. So you can read on this, okay? Conformation, gait. So this is what is termed as trot. See that the right, oh sorry. Okay, see the trot. The right foreleg is on the ground, so is the right hind leg. The left foreleg is up in the air at this gait. The left foreleg, and the right. Sorry. You might be confused. A trot. You see this is the right foreleg. The right foreleg is on the ground. At the same time, the left hind leg is on the ground. Left foreleg and right hind leg is up in the air. As it moves forward, the left hind leg will now be on the ground. So is the right hind leg. The right foreleg now together with the left hind leg will be up in the air. So it just follow like that, like marching, yeah. Two diagonal moving at the same time. So you need to trot. You need to trot for confirmation of lameness, right? I did mention while you confirm which leg it is lame, you have got to localize where the site of lameness is. You might be able to detect through visual examination, but palpation is important. Check on the area of the hoof first because this is the common area of 60-70% of lameness is in this area. So best to back in this area first. Use your hoof tester. Test it all over the area of the sole, whether there is any pain or not. If the sole is dirty, clean it up first. Brush, hoof pick or something like that. Sometimes with the hoof knife, hoof pick, you might see changes like this, right? There's a puncture sole there. Can you see that or not? You see the pointer? Pointer is gone now.
Okay.
See that? So when you clean up, you already see this. But of course, sometimes when you see, you want to confirm whether that's where the pain is. Take the hoof tester, put it on this one, pinch it. Definitely it'll be painful. Okay? So examine the hoof, examine, and then during your visual and palpation, you might feel for swelling here. This is splints, new periostitis or new bone formation at the area of the cannon bone. Okay, swollen there, you run your hand, you put your hand, you might feel hard bony swelling. In ocellates or in ring bone is hard bony swelling around this area. Swelling of the stifle, okay, like this. So visual and palpation. So I did mention about, I forgot ultrasound. For X-ray will be bones, right? Bones, right? You see multiple fracture of the sesamoid bone, something like that, right? There is ring bone to here. Ultrasound is for soft tissue. Soft tissue, which means tendon, ligament, is good to use ultrasound. Nerve block I mentioned. So radiograph mainly bones and joints, like oscillate ring bones fracture, ultrasound for tendinitis, desmitis, nerve block for area that is supplied by particular nerves, nerve block rate, flexion test, good for the joint. Sometimes you suspect muscle degeneration, you want to look further at what happened, you can even do biopsy, arthrosynthesis, arthroscopy, enzyme, biochemistry, and sometimes you even need to check the fit. Certain deficiency might be exacerbated through musculoskeletal sign, right? I did mention examination work if is needed. Okay. Any question? You have any question on the examination and how to detect lameness? Detect lameness sometimes a bit it's so difficult to explain on the what they call online. Sometimes I've got to show how it is done. But never mind, you try to make it understand and try to read. After I show you the what they call the video, then you probably be able to understand better. So any question for now?
Doctor.
Yeah.
I want to ask if let's say the animal is like already recumbent. So how do we so how do we, like, if you want to detect which leg is lame, we do trot, right? But if the horse is already lame and already recumbent, how do we detect which leg
Okay.
is?
If the horse is recumbent, this is where you have to get more history first, right? What was first observed? Is it because, for example, it could be related to nerve rather than muscle, right? So ask the owner what really happened and why the horse is recumbent. What they call whether the recumbency is because of the nerve, paralysis, the recumbency is because of weakness, horse on colic is recumbent. There are many causes of recumbency, which is not only musculoskeletal. But if it is related to musculoskeletal, for example, usually the signs are very obvious. Let's say there is a fracture of the hip or fracture of both femur in severe cases, right? That is easily noticed or indicated by history of severe trauma or something like that. So you can find out the possibility of the cause, the condition through the history. And then once owner say the horse has got a back fall, fall he fall heavily on his back or on the buttock, so it could be a fracture of both hip, right? So if you have such history, you can always confirm. That means you don't have to get the horse up, you can still examine the area, the suspected area, while the horse is recumbent. Okay, so probably that's what need to be done. Okay.
Okay,
But
doctor.
if for example there is a severe sole abscess, um, or in cases of laminitis, okay, in cases of laminitis, the horse is recumbent. But from the history, the owner will tell you that the horse had got some severe systemic disease or metabolic condition, severe metabolic condition. The horse seemed to be reluctant to move, very stiff, very painful when it's moving on the hard ground. And after a couple of days, the horse is what they call recumbent, doesn't want to get up anymore. So from the history, it will probably points toward exertional myopathy. And after that, possibly the exertional myopathy was not treated, you get laminitis. So if you suspect laminitis while the horse is recumbent, you check the sole to see whether it is sensitive on the area of the white line or the laminae. So you can still examine after you get the correct history. So remember, that is the reason why correct history is important. Okay. Any more question?
Thank you, doctor.
Okay. So if there is no more question, I would love to show you some what they call um, videos. Okay. Let me see. Just now we talked about the process of, okay, let me flow shoot. Okay, first I talk about trotting the horse. Trot. What should be a normal trot? So you observe first the video. When finished, I will run again and try to explain. Okay. Are you able to see the video? Yes or no?
Yes, yes, Doctor.
Huh?
Yes,
Yes.
Doctor.
Okay. Okay. Kalau that's the case, we start back and pause. Okay. Now, at times in very severe condition, you want even to walk the horse, not even trotting. Okay. Because sometimes when the condition is so severe, developments are very obvious at the walk. But here I show the walking because I want to give detailed explanation of how we observe for the hind quarter that what they call, I talk about symmetry of the hind quarter or the buttock and the hip hop movement. So it's best to show when the horse is walking. Okay. But of course, normal walk, you see a very relaxed movement without any what they call abnormality at all. You see this? I will talk while video is on. You just listen. So we observe the movement on the back here. See the hip? They should move on the straight line. One up, one down. See the up, up. Can you see it now? 1 minute, eh? Oh, you got to see very fast. 1 second. I try to freeze. Okay, when the horse is walking, okay, the leg that is going up. So if we draw a line here, okay, line here, see the tuber coccyx, right? Here and here, correct or not? So when the horse picks up its leg in the air, this tuber coccyx or the hip will be raised up. This one is down, slightly down. So symmetrical, one up, one down. But as the horse walk forward, when the other leg, when the left is on the ground, the right is up in the air. Oh, no. Okay, this is correct. You see, now the hip on the right is higher than the left, correct or not? Do you get the picture?
Yes.
Huh? Yes.
Yes.
Okay, if that is the case, this is where I said symmetrical movement. Symmetrical means you draw a line. Say, take this line, for example. Take this line. You take this line. Okay, one up, one down. So when this one go up now, right? This is down. They are on the same parallel. So that's what we call symmetrical movement. They move up and down on the same line. That's for normal. No, so I show walk because it's easier. So you see the walking, right? So the horse is walk away from you. Okay. See the movement there, up, down. That's normal. Or finish. They are not walking back. Okay, that's okay. Then you also look at the movement on the head. It should be the same. There's no movement up and down or head nod. Now, you see this trot now. How a horse trot normally. Okay. Okay, I've got to freeze it, bring it here. Okay. Here is the actual one you want to see, not the walk just now. I'm trying. So now you concentrate the movement of this quarter and the movement of the other quarter, of course, hidden by the tail. They'll be like walking too, up and down. But they will be moving on the same level or same plane as they are up and down. That is what we call a normal hind quarter. So when the hind quarter movement is symmetrical, that shows there's no pain or lameness on the hind leg. You see this? I'll start the video and you watch. So it's just like walking, but it's faster, that's all. Okay? Okay, I play again. Try to familiarize yourself with the movement of the, you see, the left hind leg is in the air, right? So you see the quarter here is higher than this one, okay? So as it keep moving up and down, you see the movement of up and down, or the tuber coxae. It should be on a symmetrical plane. So here we go. Okay, it's just like walking is faster. That's all. Okay, clear. Now the horse is going to be trotted towards you. When the horse is now trotting towards you, you see the head first. Trying to catch what the head knot is. See the movement of the head. The horse, the head moves, right? Slightly left, slightly right, like weaving, left, right, down slightly. So that is not head knot. Okay. After when I show you video or head nodding, then you will be able to visualize it. So we go again right through, up and down. Up, as the horse goes away from you, look at the hind quarter, they are symmetrical. When the horse is trotting towards you, look at the head, there is no head nodding. Okay, that's all. That indicate normal trot. That indicate the horse is not lame, actually. Sorry. Let me get it again. Okay. Trotting away. Trotting towards you. Sorry that we are trotting in the stable. This is not the best place to trot a horse anyway. It should be outside. But I think this is the best picture of horse trot that I have in my. I seldom take pictures or video of normal horses. So this is a normal trot. Number 3, there's another trot here. Wait. Okay, you all can hear me?
Yes, sir. Yes, sir.
Okay, good. Okay, good. So let's see the normal trot now. Okay, see this movement on the hind quarter. This one move clearer. See the hind quarter goes up and down, but they are at the same level, right? Normal. The horse is coming back. See the movement of the head. This is not head knot. It's stationary. I mean, frozen at the same plane. So when we say head nodding, I'll show you what is meant by head nodding. Finish. Try to freeze this slide. Let me see. Okay. See this? I was talking, now it's clearer. You draw a line. Okay, draw a line here. So the head goes, the right hip goes up, touch this imaginary line. Okay, so when this horse took a step, it goes up, it will reach the same plane line here. So that's symmetrical movement, okay? Okay, play, so keep going. So the horse is being trotted away from you. Look at that, there is no sign of lameness, nothing at all. Stop. Hey, sorry. There's no pause on this part. I don't know where to get the pause, but just 1 second. Let it come nearer. Okay, look at the head. Okay, so the head is being held horizontal, steady only. When we say head nod, the head will go down, up, down. That's head nod. If you look sideways, that's weaving. That's not indication of lameness. Only this head comes down, like that, and then another step it goes up. So it's nodding. It's like you nodding your head, right? So to indicate lameness, you have got to see the head. You have got to see the leg. For example, this head is when the right foot strike the ground, right? So another movement, when the left foot strike the ground, the head will also be observed. So you want to observe together. Then you will know the lameness. Okay. Okay. Play. So this is still normal. Okay. Now, another trot normal. It's important to know the normal before you are able to see the abnormal. See this movement of hindquarters? Okay. Now, see the head, yeah, stationary. You see, this one is about to strike the ground. It's on the up. But anyway, the other thing you want to observe head nod, but there are other signs of lameness too. But head nod is always there. Sometimes poor flexion of the joints, dragging of the toe on the ground. So these are indication of lameness. But head nodding must be there to indicate lameness. Okay. Okay, that's good. Now, this is another normal trot. Okay, see this, See, this is what is meant by holding the head steady. Okay, if not head not made, it goes down. The head will go down and then up, down. You see, like us nodding our head, our chin goes down and up, right? So this is what head nod is. Okay, this one I can. Okay, that's so. Have you seen enough normal? Yes or no?
Yes, doctor.
Yes.
So most important, anything, any disease, any condition, whether it is lameness, whether it's heart, whether it's gastrointestinal, auscultation, whatever, lung sound, you have to know normal. Then only you'll be able to detect what is abnormal. So that's important. Learn the normal, right? Okay, now we talk about, I talk so much about head nodding. Okay. We go for head nodding. The horse is lame. Head nodding. This one. See, it goes first, then I will describe. you want to see the head nod is when the horse is trotted towards you, not away. Of course, you can see sometimes, but it's covered by the back. See this one, head nodding. See that? That is what's meant by head nodding. So he's blocking a bit. See that? There, clearer. Now you understand what head nod is. Oh, I'm going to stop. Yes or no?
Yes.
Yes.
So this is quite classical for you to compare. You see the head nod, you see the is it there, right? Is it the same one? Same one. Down, 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 down. It's clearer here as it comes. Okay, on the side. Let's do it again. Where is it now? See? Okay. Trot limb, head nod. Try to see and tell me which leg the horse is lame. Of course, don't worry from here, don't judge from here. Judge when the horse is coming back. Okay, you see the head nod, right? I will let it go again for you to see complete. Okay, it's good to see on this side here. There was some student there, I think. Okay, see again. Because you have got to familiarize yourself with the head nod. Hindquarters is even trotting, which shows that the horse is not lame on the hind leg, right? See it coming back. Okay. Which leg is the horse lame? Any guess?
Doctor, is it the left foreleg?
Left forelegs, correct. Any more? We have ruled out there's no lameness on the hind leg. Why? The movement of the hindquarters is symmetrical, correct? You see this again, Where is it? See that? Symmetrical movement on the hindquarter. Now the horse is too far already, but don't worry. See the horse coming back now? Okay. The guess is left foreleg, right? Anybody say right? So the left is correct. That is where the left. How? I did mention just now, look at the head nod. When the problem leg strike the ground, the head is the head is raised. Okay? When the normal leg strike the ground, the head comes down. Because what is raised must come down, right? What goes up must come down. So that's why you see up and down, up and down. Painful leg strike the ground, head goes up. Normal leg strike the ground, head goes down. Painful leg strike the ground, head goes up. But for us in our assessment visual, it's a lot easier to see head nodding, right? The head goes down. If you see your friend nodding also, it's easier for you to see when the head is going down rather than the head is going up. That's why we see the head nod. So the trick important to determine which leg is that when I show you the pointer, you can see the pointer, right? When the head goes down, which leg strike the ground? Right leg. Okay. So each time the horse is trotting, right touching the ground, head goes down. Right touching the ground, head goes down. Right touching the ground, head goes down. Which means left touching the ground, head goes up. Left touching the ground, head goes up. Correct. So if that's the case, it is always head up or when the pain is. So you saw the head down, you saw the right. So the problem actually is the left. Because when the left strike the ground, the head goes up, right? Okay? So that's how you, so the trick for to see the front leg lameness is see the leg and the head at the same time. Okay? So I will finish that. And now you see clearly. Many people find difficulty when they see the head, they cannot see the leg. They see the leg, they cannot see the head. So you cannot pair the head nodding and the leg striking the ground. But after some time you practice, you get used to it. Okay? Down, 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 down right, down right, down right. So we try again. Okay, horse is away from you. So as the horse come near, you'll be able to see, right? Right down, 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 right down. See, the head not down means not there. So lameness is on the right, on the left foreleg. So are you familiar now to look at the what they call head nodding? Lameness?
Yes.
Yes, yeah. Now, again, this horse nods his leg head continuously at the trot, going away, coming back. What level of lameness is this? AAP. Of course, for non-weight bearing and weight bearing, that's weight bearing, right? Weight bearing lameness. But for AAP classification, what grade? You have 1, 2, 3, 4, and 5 to guess. Any answer? You can grade at the same time just now. Yeah. What does grade 1? Of course, when I put 0 just now, it's normal. Horse is not lame.
Doctor, is it grade 3?
Grade 3, correct. Consistent head nodding. Consistent means each time the horse take a step, the head goes down. Each time it take a step, head goes down. That's grade 3. Remember, grade 1, there is complaint of lameness, but you cannot see the horse is lame. But the owner is quite sure that his horse is lame. Lameness that is very difficult to perceive. Grade 2, there is head nod, but inconsistent. Many step is trotting normal like a sound horse. Occasionally, the head goes down once or twice, and then back to normal. Once or twice, back to normal. Grade 2. Consistent head nod. Consistent means each step there's a head nod. Each step there's a nod. Grade 3. Okay? So that's quite clear. Now, we look at the severe one. Lame at walk. See that? Okay. Head down, head down, head down, head down, head down, head down. Right strike the ground. Okay, head down, head down, head down, head down, head down. Okay, clear? So this is still head nod, but if a horse is brought down to you like this, you don't even have to trot. But if it is not so clear, you trot the horse a bit, yeah? Trot the horse a bit to see whether it is lame or not. But basically, what they call lame at walk. What is lame at walk? Okay. What grade is this?
Grade 4.
Correct. This is grade 4, but still weight bearing lameness, correct or not? It still bear its weight while walking, but just more. But the sign of lameness is obvious at the walk. Okay, walk through. Now, again, I've got this one. I don't know how to rotate the video in trying, but there's a head knot. You try to shift your screen there, you can see. Don't worry, we stop here for this one. There's another one, lame at walk. I don't know whether it's the same horse. Different horse. Okay. Hind leg. Okay. Why poor flexion? But of course, I can't get the I'm not taking from. But this is hind leg, lameness. Different, right? But I shouldn't confuse you with it. This is quite high up on the hip hop. So when we see cases, it's better to judge than to look at the slides. I think we skip that. This one more. Let me see this one. Okay. Lame at the walk. See this? Okay. See that? Okay. Consistent. So weight bearing, grade 4. Okay, what else? We have done drop. Okay, I did mention about hoof tester, right? Use of hoof tester. Important. How do you know that the horse is reacting with pain? See this? On the painful area. See that? So the moment the hoof tester is pressed, the horse jerks its head. Jerks its leg. It is actually trying to pull away from you because of the pain. You see, each time they press on the, each time hoof tester is pressed on the lesion, the horse pulls its. See it? Two places actually. 1, 2, 3. Okay. Another one, another spot. Sedent. Okay, here. Now, that indicate pain. Remember, the horse is not feeling pain or it just doesn't jerk its leg at all when it is pressed on other part of the sole. This is how it react. Finally, flexion test. What is meant by flexion test? You see this horse trotting. Yeah. Horse complained of lameness. The owner was quite sure the horse is lame. You see the movement of the buttock is not. That's not. That's why that's a bit cantering. It's very difficult for you to judge. That's normal trot. Symmetrical movement or hindquarters. So it's sound. Okay. After you see the movement again. Okay, see the movement of the buttock, the back here. This is hindquarters actually, lameness. Okay, see movement, nice movement, straight. This is not. Don't judge when the horse is cantering. It looks like it's lame. That is not. That is just a different gait. Okay. And also remember, when the horse is lame, there's nodding of the head. But if it is lame behind, sometimes there's no nodding of the head, except for the hip hop or uneven or asymmetrical movement of the hindquarter. Okay. That's better here actually. More there, you don't see more cantik semua. Okay. Okay. So that's now flexion test. The same horse, we flex. We flex for 1 minute actually. We flex the hock, padlock, stifle. Same time. So it's full flexion, maintaining the pressure for 1 minute, and then throttle immediately. Then we get a positive flexion test or negative, we'll judge. Look at this one. So after a minute, we will let the horse go. Okay. It's trotting normal again now. Watch the video closely as it goes away. Coming back is not critical. I just want you to familiarize yourself with what happened. After we discuss. Observe for the movement of the back, what that we call it hip hop. Like hopping, right? Hopping on the hips. There it goes. See this? That's hip hop. See that? Now it's getting better. Which means this horse show pain after flexion. Okay, two things I want to show on this slide presentation. Number one, before the slide before, a horse, the same horse was trotted, just cleanly trotted. You don't see any obvious hip hop, uneven asymmetrical movement of the hind leg, no nodding of the head, which means normal. The horse is sound, the horse is not lame. But based on the history, the examination, of course, doesn't show anything, but we just want to confirm that what the rider suspect that the horse is lame on the hind leg. Just to test the joint, we do a flexion test. The moment we flex the horse for 1 minute, we trot immediately after the flexion. We see the hip hop movement or asymmetrical movement on the hind quarter, which indicate lameness of the hind quarter. You realize not, the horse actually is jumping, right? Jerking. Do you see that or not? Yes or no?
Yes.
Okay, good. So that's why it's called hip hop. So that indicate the horse is lame. Okay, now the lameness, although it is not observed on the normal trot, but is observed on the flexion test. So that indicate that it is a positive flexion test. So we use the aids of diagnosis, it confirm that the horse is lame on the hind leg. So once you know the lameness, which is left, the moment it is lame on the left hind, confirm, then you can do further investigation. Remember, when you flex the hind leg, you are flexing the hock, you are flexing the stifle, you are flexing the padlock, you are flexing the pastern at the same time. The question now is which joint? Very difficult from the flexion test. But what will you do? You confirm that lameness is on the hind quarters, left foreleg. Let me see where the. See, like this guy, he do flexion test by holding the hoof. So padlock, pastern, hock, stifle are all even hips are all flexed or pressured. So you have a positive case, horse is lame, but you cannot say which joint it is. Very difficult. So what I usually flex, I will hold the cannon bone. So there's no pressure on the fat lock piston. I hold the cannon bone as what is being held here. I flex, so the hock is flat, the stifle is flat. The hip is pressured, of course, not flex. A lot of pressure here. So when the horse is positive for flexion test, the problem is either on the flex area, hock joint, stifle joint, and the hips. Okay, so this is sometimes called Sprevin test. More common pain is on the hock joint. So most likely the lameness is on the hock joint. Okay, so the horse was tested positive on a flexion test. If there's nothing wrong with the joint, we flag the horse will be trotting normal, no what they call hip hop, just the same as what we saw in the first horse that was trotted, the same horse trotted without the flexion. Okay, any question?
Doctor,
Yeah.
if both forelimbs are in pain, how will the head knot be like?
Okay, it's both, good question. Is both foreleg is lame? Now, number one, one possibility, there will be a head knot on the most severe leg, most severe, most painful leg. If the left leg is more painful than the right, it will head knot when the right strike the ground, indicating left foreleg's lameness. If the pain is more severe on the right, it will head knot on the left leg, indicating more indicating lameness in the right. Now, but since this is lame on both sides, you won't get a classical head nodding. You might still have a head nod, but you will see other, or the horse will exhibit other sign as well. Whenever there is pain on a particular leg, the horse will try. It's not, remember I was telling about the hind leg, right? Poor flexion and whatnot. For the for the front leg, if a painful leg strike the ground, it's painful, the horse as far as possible want to lift the leg quickly. So the right hand have got to take over for the left leg to be raised to reduce the pain. So in cases of lameness, whether it is foreleg or hind leg, we call the contact time. The contact time of the hoof or the foot on the ground is reduced. Just like you are lame on your left leg. You are lame on the left leg. When the left leg is if you are walking, when the left leg is on the ground, it's very painful, right? You will quickly shift the leg so that the right leg will take over, which means the contact time for the left leg is shorter than the normal leg to reduce pain. Because when the leg is up in the air, there's not much pain compared to when the leg is supporting weight. So the contact time for the problem leg on the ground is very much reduced, and the contact time on the normal leg is longer. So that's what we call what they call, we detect lameness or pain on the leg as well. Now, if the horse is lame on one side, that's what happened as I described. Contact time on left reduced, normal contact time on right. When the left is contacted again, the time is reduced so that the left can quickly be picked up. Now, painful on both sides. Imagine the horse, let's say now we take the left is painful. When the left strike the ground, it's so painful, right quickly took over, reduce contact time of the left. But the moment the right strike the ground, is painful. To reduce contact time, quickly the right leg is raised up, the left strike the ground. So each time it does that, it's painful, both sides. So what will happen? This is what we call very short gait, very short, quick gait, which means that the horse will take a very short gait, one small step at a time, because with one small step, quickly raises up, leg up, that's less painful. So it's like what? It's like, I usually call it like a cat. Have you seen cat running? If you are not, you have not seen, Next time when you near a cat, try to chase the cat away. When the cat or run, not walking. When the cat run, the front leg takes such a short gait. It doesn't strike long, very short. Okay, short funny gait. So horse will do that. It will take a very short step. It will take a quick step. So it is like a cat running, very quick. So like shuffling, right? Like shuffling. Okay, that answered the question.
Okay, thank you, doctor.
Okay. Any other question? So we are almost 1.5 hours. Eh? So put it this way, if there is no other question, you have my email. You don't check with the class rep or check with the Dr. Intan. You have my email. You have my phone number. Communicate with me. You are not clear. Go back, read all the notes again. The notes are well packed with points. Read it. You will understand better. Have a look at the videos. Try to study it, especially video of hoof flexion. This video, flexion test, video of hoof tester, and the video of a lame horse. Right, the last one I showed is very clear, or the first one. So look at that and familiarize yourself in determining which leg a horse is lame. If you are not clear, still you can communicate with me. Watch the video as many times as possible. Check the course. This one whether my note have gone in. If not, inform me. I will update and put it in the system. Okay? Is that okay?
Okay, doctor.
Okay. Any more question? So kalau tak ada apa-apa, we can now quit. Take a good break lah. And I know about just now this morning they were mentioning about your apa? Your test. I'm sure the test will include my portion, right? So take care, all the best, and communicate with me. Okay. Bye then.
Okay, doctor.
Stay safe. Okay. Bye then. Thank you so
Thank
much.
you.
Thank
Thank you, doctor.
Thank you, doctor. Have a
Thank you,
nice
doctor.
day.
Thank you, doctor.
Thank you,
Thank you,
doctor.
doctor.